What should you do with your uninspired or unused medications? I talked with two professionals that have important advice to share. A pharmacist and a police officer have a lot more in common than you might think. Both are on the front lines of fighting the growing opioid epidemic locally.
When somebody starts on opioid, it's because they most times either had an injury or had a surgery or got in a car crash or something like that.
I feel it's a problem everywhere.
Meet Brentwood Police Officer Bill Reap. He's responsible for the disposal of all unused medications dropped off in this secure box.
The first time I emptied the pill take-back box located in our lobby, till now we've collected 820 pounds.
Reap says your medicine cabinet is a target and should be secured.
Try to get the word out there that having them there in your house is probably not a good idea, that it is a target for people.
On another front of the epidemic is pharmacist Todd Garrett in Franklin. He owns Franklin Family Pharmacy.
So an opioid is a medication that's used to treat pain. Most often it's used after surgeries when somebody's in a lot of pain. It works on mu opioid receptors, and it basically just blocks pain signals.
Garrett says that not everyone gets addicted, but some do.
There are other people that when they take opioids, it hits a reward pathway in their brain, and that's what leads to the addiction most times.
Garrett advises all of his patients to use small amounts of opioids and says there are alternatives.
My role can be to say, hey, use as little or none of this if possible. Try to use Tylenol and ibuprofen if that's okay with your doctor.
Both professionals want to see everyone do the responsible thing.
You've got anything that's expired or unused in your medicine cabinet, you can find these local collection agencies that do it 24/7.
If your community is having a drug take-back day, I think you should absolutely participate in it.
Take-back events happen twice a year in Brentwood. Almost 5,000 law enforcement agencies nationwide participated in the last drug take-back day earlier this month.